The patient will be performing a squat with a ball. They will place the ball in between their back and the wall at a comfortable position. They will perform a normal squat with proper technique and until it is pain-free. The patient will remove the ball and perform a freestanding squat. Again, watching for proper technique, and we want this to continue to be pain-free. For the second progression, the patient will move to a single leg squat. Standing on the injured leg, they will balance and perform a squat, again to the point of pain-free.
This exercise is called knee extension. For this exercise, you will place the patient in a seated position with their legs hanging off the table. Place a pillow in between the patient's knees and have them squeeze it together. Ask the patient to extend their knees, bringing their feet up to the ceiling, and slowly bring them back down. To increase the difficulty of this exercise, place a rolled towel between the patient's knees and do the same extension exercise. To increase the difficulty of this exercise, again, move to a small ball and repeat the exercise. To again increase the difficulty of this exercise, you can increase the size of the ball to a basketball or a soccer ball.
For this exercise, we will be performing straight leg raises. In this exercise, it will involve the leg moving 4 directions, and it will be performed on each leg separately. To begin the first section, the patient is lying on their back, toes straight up in the air. Leading off with the heel, they will raise their leg straight up in the air in a pain-free motion and slowly bring it back down. For the next section of this exercise, the patient will lay on their left side, legs straight out, toes pointed straight. They will again, leading with their heel, lift their leg straight off in a pain-free motion and slowly bring it back down. The third portion of this exercise involves the patient on their stomach, toes pointed straight towards the floor, leading with their heel, bringing their leg straight up behind them in a pain-free motion and slowly bringing it back down. For the last portion of this exercise, the patient will lay on the injured side, placing the opposite leg over the injured leg, toes pointed straight ahead. They will lift the injured leg straight up and down in a pain-free motion. To progress this exercise, you will add weights onto the ankle. You can use weight such as a can of soup or an everyday object you find around your house. You will put the weight around your ankle, toes pointed towards the ceiling, lift your leg straight up in the air as done before. You will do this exercise in all 4 directions on both legs. To increase the exercise again, continue to add weight as long as the limb stays pain-free.
This exercise, the patient is standing up performing glute crunches. The patient will squeeze their butt muscles together. The first progression, the patient is leaning against the wall. They're going to clench their glutes together by raising their leg at a pain-free motion. The final progression, the patient is still standing up against the wall. You still will squeeze your glutes together while kicking your leg. This is called wall kicks. Make sure your toes are pointed straight up and still do it at a pain-free motion.